majority have NHIF. So right now in the minds of people, only those 89% who have an NHIF cover of the ones who have insurance believe that they will be qualified to get a UHC. This UHC stands for Universal Health Coverage. It means access for healthcare, quality healthcare services to all irrespective. So the only thing you need to get a UHC card in our understanding is your ID. The only thing is that you have to go to an NHIF facility to get it. Are we together? So you don't necessarily have to have the NHIF card, not at this point. So we've talked about awareness, and awareness is low at 31%. We've seen that there are misconceptions with what UHC is, and I think that needs to be sorted out and crystallized as the nationwide rollout continues, so that it is truly access to all Kenyans. Now at this point, when we realized only 31% understood what this universal health coverage was, of course we had to explain the concept to them, and the concept will explain the way I've read it out to you. UHC is a government program meant to ensure all persons receive quality health services they need without spending a lot of money. And then you have to be a Kenyan citizen, you have to register to obtain a UHC card, and right now it will be issued at the NHIF facility near you. Registration is free. One will be required to produce his or her UHC card to access the facility. So once we did this, once we explained to Kenyans what UHC was, then you will not be surprised that majority of Kenyans, when they were asked, is this an important program to you, said yes. So 82%, after understanding what the concept of UHC was, upon explanation and prompting, were very clear that it was an important program. And you see how the importance is high across the board, but then I don't know what's happening with Nairobians, because Nairobians are skeptical. They are not sure. So you see 20% of Nairobians actually saying that they're not sure whether this UHC program is actually important. And 11% saying that it is not important at all. In fact, the highest incidence of not important as a program comes from Nairobi. So I guess it's skepticism with seeing so many things coming up and few working, some not working as well. So which health facilities and packages would you wish the UHC cover to apply to? And you see that majority want the UHC to cover all public and private healthcare facilities at 53%, and 34% believe that all public health facilities should be covered. But most people generally want UHC to cover both public and private, not just public healthcare facilities. And what packages? They want UHC to cover inpatient, outpatient, non-communicable diseases, communicable diseases, prenatal, so all reproductive health and pediatric services, dental, optical, specialized care. So they want, because it is universal health coverage, which means that it's meant to be giving you all cover or access to cover in a proper manner, then you can see that majority of Kenyans pretty much wanted to cover all sorts of packages for health. Inpatient, outpatient, communicable, non-communicable, reproductive, pediatric, dental, optical. But the main ones are inpatient and all inpatient services and all outpatient services. Now that we have explained UHC to you, even you in this room, the ones who did not understand it, how likely would you be to actually register for UHC in future? And you see that the likelihood to register after being explained to what the concept is very high. So 75% are likely to register and get a UHC card. And that likelihood is very high everywhere. Pray for slightly, low, incidences in Nairobi and Coast. So Nairobi and Coast are very skeptical, because even with the not sure, you see that the incidences are quite high. You have 22%, you have 26% in Nairobi and Coast, who are not sure as to whether they would register, even after we explain to them what the UHC cover is. What factors, if any, would most determine whether you will register? First is cost. Is it free or not free? That needs to come out very clearly from government, so that you see 61% of Kenyans saying what will depend or determine whether they register for UHC is the cost involved. The second thing is the type of health care services covered. Many people, as we have seen, believe that it's covering both public and private. But if they were to find out that it's only public, one wonders whether they would then be interested in registering fully. And then the type of health care facilities covered. So is it inpatient, outpatient only, or is it going to cover everything that one would need to have covered or wish to have covered, as we saw before? And you see that costs is an overriding factor. And I think I can't belabor it anymore that from our literature review and understanding, talking to experts in those pilot counties, right now UHC is completely free. So the people who have gotten the cards during this pilot phase have not had to expend any money to get services. Perhaps the money that you will see they spend is money they spend to get to the facility, right? So now if we look at the pilot counties, and we just see whether they have registered for UHC in those 4 counties where there's been awareness, there have been road shows, there have been TV adverts, the county government has increased impetus in educating people about UHC. One would expect that because it's such a good thing, no? We're seeing that it means that you have access to, as a person, to receive quality healthcare services without spending a lot of money. But look at the penetration right now. So only 42% of Kenyans in the 4 pilot counties that have been introduced to UHC right now have registered for the UHC card. So about 68% are yet to register. How will we know how well this thing is working if we don't have significant percentages of people in those particular pilot counties registered? That's one. Secondly, why have they not registered for the UHC card? What are the barriers right now? Is it that they don't know? We've already seen that awareness is extremely low. So if you don't know, you will not use. So the increased impetus on awareness needs to happen. And when did most people register? 58% who have registered a while ago. That is more than 6 months ago, but not more than a year ago. So we have very few people who registered, longer than that. But there are also about a quarter who registered within the last 3 months. And what we see with the registration, that 42% who have registered, majority of them are what? They're older. Let me not call them old because I belong to that age. So they're older, more mature, maybe wiser people, I don't know what but then it is really the age groups, as you can see there, 56 to 65 years old, that's 42% of those who have registered. And then 46 to 55 has 37% of those who have registered, and we see above 65, 33% of those above 65 have registered. Our youth are, 18 to 25, we only have about 30% who have registered, and then the 26 to 35 are 32%, and 36 to 45 are 30%. So, again, perhaps in terms of how we are sensitizing the public, the mode of communication, the understanding of what UHC is, needs to be done in a much more refined manner. So we have all cohorts, all age cohorts, registering for UHC. Have you spent anything in those pilot counties? And you see that majority have spent nothing. So 76% of those in the pilot counties have spent more. Does this pose a challenge moving forward? Perhaps. In the pilot phase, I spend nothing. What when you introduce a fee? What happens? Will I use my card? I think that's something that the policymakers will have to grapple with. What has been your experience in using the UHC to access various services? And generally, the experience of those who have used healthcare services with the UHC is, as you can see there. For availability of quality medicines, the rating of good is 41%. Availability of lab services, 52% have rated that as good. Availability of qualified health personnel, the rating of that is 56%. Availability of medical equipment, rating of that is 46%. Availability of emergency services is rated good at 43%. And then affordability of healthcare services, you see, is rated highest at 62%. And then they also have rated quite well at 60%, being treated with dignity and your privacy being respected. But time taken to access the healthcare services, how long you wait, was not given such a good rating. The good was only at 48%. Are you satisfied generally with UHC? If it works, if it's rolled out well, if it is given, the kind of attention and impetus that it deserves, then UHC will have very satisfied customers. So you see that 73% who have actually used the UHC cover in the pilot counties. We have to commend government for that. Right now, that the satisfaction is high for those who have used. What do they like and dislike about UHC? One, the most important thing in terms of what they like about UHC is what? Is that it's free. So 85% say it's free. And cost has always been one of the prohibitors of access to quality healthcare. What don't they like? They don't like the fact that, as mentioned by 39%, that there are inadequate medicines. 37% also said the time taken before treatment. Because it is free, you can imagine the numbers of people who know about UHC who then are visiting. And then, there are not enough, resources to take care of everybody. Then 20% said it's not in all hospitals. You see, the perception is that it's meant to be in all hospitals, but 20% then don't like the fact that it's not in all hospitals. This is of the people who have used UHC, yeah? And then there is poor service delivery that was mentioned by 3%. If government asked for your advice on the best UHC plan, what would you advise government to do? So this is the message from the 4 pilot counties and people who have actually used UHC on what they would advise government to do to make UHC a desirable and successful program. The first thing that was mentioned by 36% of Kenyans is that it should be used in all hospitals, private and public. That is the message from the pilot counties. The second message the pilot counties, UHC pilot counties are giving government is increase the medicine supply in the health facilities. That was mentioned by 30%. And then 28% said cover all expenses, diseases, and also make sure that UHC covers inpatient, outpatient. Then of course, they are saying 4% have said, can you please register more people for the UHC program? And 1% also mentioned increase the number of medical personnel and doctors. But the first thing is the access, and that access is that they want UHC to cover both private and public institutions. That generally brings me to the end of the findings for today. I think I will hand over to Collins, and if there are any questions that you have, I think we will play it out. Collins, do you want to come back? Collins colleague is coming. Yeah.
Thank you, Angela.
All right. Yeah.
that's basically for us on what we found out about the interview. And it's interesting to note that we were told that UHC is going to be a rolling exercise. More children are being born, and therefore there's the need to have them registered. Yet in the pilot counties, we have registration closing. So, and that came out in the survey. More people need to be registered, so we need to keep the registration open. Another interesting aspect was Kenyans are complaining about taking long time in hospital, but they cannot relate it to the fact that there is the issue of personnel. Where does that leave us? Ladies and gentlemen, I don't know if there are questions to the team, and I would invite questions. My colleagues in the spread across the room will help us tackle some of the questions as they come. Yes. Any questions, any concerns? Does the survey talk to some of our concerns? Are there glaring gaps?
Yes. My question would be, because the government, when it was rolling out the pilot phase for UHC, the main agenda, as they said, was to learn from the shortcomings in the pilot counties. So would you, as InfoTrak or the People's Health Movement, say UHC so far is a failure or a success? Because we're also looking forward to having it roll out in the other 43 counties beginning January. Okay. And then you said you only dealt with people from 24 counties. And how are you able to get information about the remaining 47 counties, the other counties?
Okay. Maybe we'll take a number of questions, respond, then do another round. Any other concern? So far, is it a failure or is it a success? And what is the representation of the other counties? Is there another concern? Well, I think we are satisfied. Looks like we are satisfied. Or we got lost somewhere in between. Collins, yes. Is UHC a failure or success based on what we have?
If you look at the findings of the, thank you very much for that question. If you look at the findings of the study, you realize that in the UHC pilot counties, penetration was actually averagely 42%. Given that the pilot stage is actually coming to an end in the next 2 months, because it's supposed to end on 12th of December when we celebrate the UHC Day, it means, in my view, or in our view as those who work with, with the grassroots communities, that's a failure, because then we expect that everyone at this point in time should have been covered in those 4 counties, given that the government had already put in some resources, plus other development partners who had already put in resources. So we're expecting that with the availability of resources and proper strategies in place, then we should be talking about 100% coverage as at now. So if we are still talking about 42%, then it means we did not actually achieve what we wanted to achieve as a government.
Right, I think the other question was more a methodology question, yes? So my dear, you asked, why didn't we cover all 47 counties? Because this is not a census, this is just, a survey. And so what we normally do is, so that we don't spread the samples too thin, the sample is 1,200, yes? And you saw it was split by county. What we try and do is make sure that at least the minimum sample per county is it's ranging 30 and above to give us significant sample size for us to make inferences. But what matters is that when you're sampling is that you cover the whole universe that you have. So when we look at our universe, we start off by saying how many regions do we have? We have 8. And if we're doing a nationwide study, then we have to cover all 8. Do we have to cover every single ward, every single county, every single district or whatever it is in those regions? No. What we need to do is ensure that we have a representative coverage of each one of those regions. So that, for instance, if you are in Rift Valley, you want to make sure that you have covered Upper Rift, so North Rift, South Rift, and Mid Rift. If you are in Nyanza, you want to make sure that you have covered the Luo Nyanza, or Central Nyanza, and South Nyanza. If you're in Eastern, you can't say you've covered Eastern if you only go to Isiolo, isn't it? You have to go to Isiolo, you have to go to some place in Embu, or Meru, you also have to go to Upper Eastern and Lower Eastern, yeah? But generally, for the perception areas, what we wanted to understand is the views of Kenyans generally. And only 4 counties have had the pilot testing, yeah? The rest do not have, and you can see that the awareness in all is still significantly low, at 31% awareness overall. Yeah? Does that answer your question?
All right, again on whether UHC is a success or a failure, I think most of us have seen media articles on drugs shortages in the pilot county. Yet, when we look at our budgets, we have a total of about 70% that is going into procurement of drugs. Then the question we should be asking ourselves is, then where exactly is the problem? Is it a problem of procurement? Is it a problem of allocation of drugs? So these are some of the things we need to be asking ourselves and seeking answers, even as we look at the countrywide rollout. The other aspect, I think it's also good to give credit where it's due. Counties have recorded an increase in number of citizens accessing services. But again, we appreciate the fact that in as much as there is an increase of individuals accessing services, there is the workload. We have shortage of HRH, we have shortage of commodities. So it is a tricky balance, whether to say UHC is a success or a failure. But the fact is out with us. I don't know if there's any other concern. Or clarifications. I'd invite Collins to wrap it up for us. Thank you.
All right. I still want to add a few more points to the previous answers that I've given. From the findings as well, you realize one of the problems citizens are facing is actually access to drugs. So we cannot still be having a problem with access to essential commodities and drugs and say that's a success. I mean, if you go to hospital today in Kisumu or whichever county you go to, and you're still sent out to go and buy drugs in a private chemistry outside that hospital, it means there is a problem. It means you're still going to pick money from your pocket to go buy those drugs outside that facility. So it means that's not a success. Secondly, just a few weeks ago, I think 1 or 2 weeks ago, we had a strike in Kisumu, for example. That's a pilot county. When we still have industrial action and we still have people struggling to go get those services because those who provide those services are actually on strike. That's not a success. We are still having a problem. So we are looking at a more vibrant, health system that is able to effectively address the needs of the citizens at the point of need. We are looking at a system that is more efficient in terms of you go to the facility, you don't take too long for you to get the services you want and go back home. We are looking at a system that addresses every other need. It doesn't matter where you are or who you are, it addresses your needs. But when you have a system that sort of has a problem and we are still having industrial action, we are still having citizens lining up for a very long period of time trying to get the services. I'm aware of some places where you are actually sent back home so that you come tomorrow because we are not able to serve you. And we are still talking about, lesser or fewer, service providers who cannot address the problems that we are facing. I think essentially what we are saying is UHC is a very good thing, as you've seen from the findings. Actually, 80% of Kenyans agree that this is what we want. But the problem we have is the process of, having UHC as one of the things we want in the country. So if you ask people to come to a hospital where everything else remains constant, the doctors, if there were 2, they remain 2. The supply of drugs and the social commodities remain the same. The budget for that hospital remains the same. Every other thing is constant. The facilities remain the same. But then you ask people to come in for free. Exactly what are you going to get? It's congestion and nothing other than, desperation. So we did this because we wanted a national discussion around UHC. We want a more inclusive discussion that involves everyone, and then every other thing that involves communities who are the beneficiaries of these services, so that then as we move forward, we are collectively agreeing that this is the kind of direction we want to go. As at now, we still don't know whether the government is implementing the insurance-based model or the tax-based model. We are not aware. What we know is that there is UHC going on. And there is also a problem with information, because those who are registered for UHC actually got it for free. And from the findings, you can see they are saying one of the things, the triggering, factors that made them go to register for this UHC is the fact that it was for free. So the question then comes in, this is a pilot. When we now get into real, implementation of the other aspects of UHC in the country, are we still going to do it for free? We are not aware of what is going to happen, but for sure it's not going to be for free. And if that is the case, are we still going to have those people, peeping in and out of facilities to be registered? The answer is obviously no, because essentially Kenyans suffer from increased out-of-pocket spending on medical care. So we still have those questions, and the reason as to why we did this was to actually generate a discussion that could help us shape how we would want to see universal healthcare look like as a country. I don't know if there are any other questions. If not, then we should be finishing at this point in time. Any other questions?
Yeah.
Sorry. More lastly is that we have developed a communique to this effect, explaining why we did this, and we shall be sharing it in the next 1 hour with all journalists who want to take that story. So I've been given this, so that if you want to follow up with the communique, you can put up your email here, and you will get it on your email in the next 1 hour. Thank you very much, ladies